Okay, so if you've searched for natural allergy relief or supplements for allergies, well, you're not alone. Many people want something gentler than medication, something natural, but also something that works. So let's talk about evidence. I'm Dr. Lola Ashaye. I'm a board certified family and lifestyle medicine physician and founder of InTouch Primary Care in Sugar Land, Texas. And what we do is we provide membership-based care for people who value thoughtful, unrushed visits and preventative-focused strategies. So I work mainly with adults, especially women in midlife, who want clarity and a clear plan instead of confusion. And many of our patients come to us when they're ready to stop reacting to symptoms and start building real sustainable health. Health insurance is not required, so you're all welcome. So today we're going to be talking about supplements and natural relief for allergies. First, an important point. The American Academy of Allergy, Asthma, and Immunology states that they cannot recommend for or against specific herbal products due to insufficient high-quality evidence. So that doesn't mean supplements don't help. It just means that we don't have a lot of data. The data is limited. But let's talk about the ones with the strongest evidence. So, first one I want to mention is called butterbur, but it has the most robust research among supplements. Multiple trials suggest that it might improve seasonal allergy symptoms, similarly to non-sedating antihistamines. So antihistamines are things like cetirizine, which is Zyrtec, loratadine, which is Claritin, um, fexofenadine, which is Allegra. So similar to those, okay. And we talked in the last time, in that the last episode, that depends on what your symptoms are. Some may be more effective than others in terms of whether you're doing antihistamines or nasal steroid or however you treat it. All right. So in terms of supplements, though, butterbur has the most robust research among supplements, and they're similar to non-sedating antihistamines. However, much of the research received manufacturer funding, and so it needs to be replicated independently. Another option for treating allergies more naturally is probiotics. So especially multi-strain formulation. Some of them may improve allergy-related quality of life um, scores during allergy season. But again, results are strain specific and mixed. Okay. Other supplements like polyphenols like quercetin and apple extracts may also reduce nasal itching and sneezing, but again, quality of evidence is low. So vitamin D for people that are deficient may be helpful as well to improve allergy symptoms. But here's the bottom line. Supplements may help some people. They're generally well tolerated short term, but none of them have reached the level of recommendation seen with, nasal steroids or even immunotherapy, which is more long-term management. Remember, they're adjuncts, they're not replacements. What about essential oils? So some people do feel relief with essential oils, especially blends that contain eucalyptus and certain polyphenol-rich extracts. And there have been combinations that have been studied in small trials for allergic rhinitis. A few small studies suggest some essential oil blends may improve nasal obstruction and overall symptom scores. But again, science is limited. There's just not enough data to strongly recommend it. But results also vary based on the formulation and the individual. So something to note about some of the ingredients, especially menthol containing oils like peppermint, they can actually trigger or worsen symptoms in some people who are sensitive, especially people with allergies or asthma, because menthol can create a cooling sensation, which may feel like better airflow, but it actually doesn't reduce inflammation. So If you do use essential oils, think of them more like comfort for people, not really for, a long-term allergy solution. But if your allergies are mild, it may be worth trying carefully. Obviously, you need to talk with your doctor, your own doctor, to determine the best way to go about it. But if you're unable to breathe, if you're losing sleep, if you're missing work, if you're always tired, supplements should probably not be your primary allergy management strategy. And this is where long-term thinking matters. So if you live in Houston, where we know there's a lot of mold, there's pollen, and you're relying on antihistamine year after year, you may want to consider whether retraining makes more sense than cycling through, natural remedies. And we can help you with that here at InTouch Primary Care. If your symptoms are mild enough for lifestyle and other adjunct options, we'll let you know. If it's time to address the immune response itself, we'll let you know. So if you're tired of rushed appointments, you're tired of prescription care only, you want to come join us at InTouch Primary Care. Here we care for busy adults who want proactive, personalized medicine, not just symptom management. And we focus on identifying root causes, building long-term strategies, and helping you feel well consistently, not just when something is wrong. So if you want to explore personalized allergy testing and long-term treatment options, including immunotherapy, we'll be happy to guide you through that decision. And in the next episode, we'll talk much more about this. If you have questions, remember to subscribe, put them in the comments, and remember that prevention is not random. It's actually very strategic. And when it's done right, it actually changes everything. I hope that helps.